Hey everybody, Cara Castronuova at the White House with Dr. McCullough, who we're talking about the ACIP. That's a new advisory panel that Robert Kennedy Jr. put in place, and your opinions on it. I know that their last meeting is today. What are your thoughts?
The Advisory Committee for Immunization Practices is actually a panel that's been around for decades. It's an official government panel. New members, and it's a range of individuals from vaccine developers, scientists, and doctors who actually take care of patients. They are revisiting the childhood vaccine schedule. I think the public can expect changes that will lessen the burden of vaccines on small children and hopefully make the entire program safer.
And what are the modifications that they're talking about? I know that there's a few.
The first is to extend the age at which the first MMR vaccines, measles, mumps, rubella vaccines, are administered, hopefully getting out of this critical period of neurologic development. I personally would like to see risk stratification. That is not all vaccines for all children, but actually specific vaccines for children at specific risks. That would lessen the chances of side effects or complications.
Okay, great. And any thoughts on the CDC director? Who would your 5 top recommendations be besides yourself? I'm recommending Dr. McCullough, but if you had to recommend a few people, who would you say would be great?
Yeah, I've had a chance to advise some on this. The CDC, at over 12,000 employees and at a budget of over $9 billion, to essentially provide doctors like me recommendations, it's too much. Now, they have some core responsibilities for outbreak analysis, in vitro diagnostics, and analytics. But the CDC needs an administrator who's going to trim that organization, make it much more responsive to physician needs. And I hope it's someone who clearly has medical authority, someone we can look up to and say, that doctor understands the priorities, particularly in the setting of a crisis like a pandemic.
What about the Surgeon General from Florida?
Dr. Joe Ladapo was a personal friend of mine. He was on the very first McCullough protocol for early treatment of COVID-19. I think would be one of the most qualified candidates for a range of positions in the United States, from Surgeon General, from CDC Director. And what we may ultimately have is an oversight panel over everyone, including RFK. Remember, even RFK needs a doctor of medical authority to guide him on what's the best way to improve public health for America.
So we're looking for a real doctor that actually is objective. That's what we're looking for. I think it's not asking too much, Dr. McCullough.
You know what? You deserve it. All the mothers and fathers out there deserve it. People have said they've lost trust in their doctors and public health. Now's the time to restore public health, and so we do need doctors and administrators who are credible and empathize with the concerns of the public.
Top qualification would be, I think, somebody that doesn't take big pharma dollars or doesn't have that history. It just can't work out. I don't think it has to be somebody who has not done that before. I don't know if you agree.
We have to have freedom from bias, and I can tell you as an academic physician, there are grants, there are funding mechanisms, and other financial ties to the biomedical research complex. But when it's obvious biases, I'll give you an example. We had Paul Offit, a vaccine developer who had a patent on the rotavirus vaccine. He can't be on the committee that's going to usher in rotavirus vaccines for children. I mean, these obvious conflicts of interest. Individuals at the National Institutes of Health have patent positions on Moderna's COVID vaccine. I mean, these obvious conflicts of interest. And the other thing we actually have to do is have what's called restrictive covenants. We've had far too many government officials, after they curry favor for industry, leave their position at the NIH or FDA or CDC and take a job in industry. We've seen that time and time again. The future job with the biopharmaceutical complex is a way bigger conflict of interest than actually monies that are transacted during the course of their tenure.